Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the tea. Tea Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. We are 3 weeks in to these August shows. I've been super excited about these conversations that we've been having about dating. Last week we talked about incarceration, and this week is one of my favorite topics because we're going to be addressing some of the ramifications of the overturning of Roe versus Wade. And we're also going to be talking about women's maternal health. So we've got a good show lined up for you today. Do remember that if you have questions, to go ahead and drop them in the chat, and we'll do our very best to get them answered for you. But without further ado, I would like to introduce a very special guest to Tea Time with Dr. Tarver, Dr. Wesley Chambers, who attended Morehouse College, where he majored in biology and graduated summa cum laude. He attended medical school at the University of Alabama School of Medicine and completed an OB/GYN internship and residency at the University of South Alabama Hospitals in 2014. He is a board certified fellow of the American College of Obstetricians and Gynecologists. He is a physician focused on women's health and is especially interested in prevention of gynecological cancers. He is currently working in private practice with his father, Dr. Crandall Chambers, who is also an OB/GYN physician, and he is the very proud husband of Shannon Chambers and the father to John, Jada, and Kyle. Welcome to the show, Dr. Chambers.
Thank you. Thank you for having me.
You are so very welcome. So let's get right into it because we already talked about, I got lofty goals for all of the things we'll be able to get into on this evening. So I mentioned the overturning of Roe versus Wade. I know that has had a lot of impact, particularly here in Georgia, because we had a heartbeat bill that was in place prior to that is now we're returning back to. So could you just give a little bit of information? I know some people may not even be aware of what that means, but what are we currently dealing with here in Georgia about a woman's ability to be able to even qualify for an abortion?
Well, women's reproductive services have been drastically limited in the state of Georgia prior to the overturning of Roe versus Wade with the Dobbs versus Jackson decision. Women in Georgia could obtain abortions or obtain reproductive services up until the 22nd week of pregnancy or 20 weeks after the fertilization. And so with the most recent House Bill 481 being actually allowed to go into effect it was kind of held up in the district courts after the Dobbs versus Jackson decision, but it has now been allowed to go into effect. And so at this point, a woman cannot obtain any reproductive services in the state of Georgia after the point at which a heartbeat or some kind of cardiac activity can be detected during a pregnancy. So usually that occurs around the 6-week mark of pregnancy.
So we're talking about pretty early on where some women may not even realize that they're pregnant by that time.
Right. A lot of women do not know that they're pregnant at the 6-week mark of pregnancy. Most women find out that they're pregnant at the time of the missed cycle, when they have a menstrual cycle that doesn't come and then go and take a pregnancy test. So that's when we usually detect pregnancies. That can be detected, a little bit earlier than 6 weeks. But for women that have any kind of irregularity in their menstrual cycle, the 6-week mark might not be any kind of alarming situation for them. So they might not even be, seeking verification of whether they're pregnant or not at that point. And if you go to seek abortion services and the provider finds that there is a heartbeat detected, you will be denied those services in the state of Georgia.
So you may be at a point where you're just now learning, trying to figure out what your options are. And by the time you get there, it's too late for you to do anything here in the state of Georgia.
Right. And so, we're talking about the patient having time to even detect that they're pregnant, but we also have to acknowledge that deciding whether or not to carry a pregnancy to term is a very monumental decision. And sometimes it takes some time to come to the conclusion as to what you want to do. whether you want to access reproductive services or whether you would desire to go forward with carrying a pregnancy to term.
And so given the current law in Georgia, a person really doesn't have a lot of time to even be able to talk through those options. If they're already at this 6-week mark, then the likelihood is very slim that there won't be a heartbeat detected. So they may not even had a chance to talk to a partner about this and think about any of these things that you talked about. That could
Right.
be.
I mean, they might not have an opportunity to see a physician and to discuss any kind of prior health issues that the patient may or may not have that may affect such a decision. They might not have time to consult with spiritual leaders or people that they respect in terms of their moral decisions, and when it comes to making those, who they might consult with regard to that, or just talking to spouses or family members. And so it's a very harsh and limiting piece of legislation that was passed.
And I think about people, like you mentioned, not even having a provider yet. If I wasn't planning on having a child, so I may not even be seeing a gynecologist regularly. What if I live in a rural area? What if I'm in a position where I don't have insurance right now, or insurance benefits are too expensive or limited for me? So I'm not even in the position to have someone to consult with by the time that I would be essentially forced to have made a decision if I was going to be able to consider an abortion as an option.
Well, the most recent data that I could find showed that about 1.3 million Georgians are uninsured. About over half of Georgia's counties do not have an obstetric provider in the county. And so there are some significant barriers to access that women are facing. Many women do not have any physician that they're seeing on a regular basis. A lot of women, about 20% of women, have not seen a provider in the past 12 months in the state of Georgia. And so, it's very limiting. Resources are limited, patients' access is limited, and now you are putting a very severe time limitation on patients. And so this legislation pretty much eliminates access to reproductive services in the state of Georgia for all intents and purposes.
And that was what I was wondering, because I think about as a new patient, even being able to get in to see a provider, and what your wait time would be to get in.
Yeah, there are many providers who are going to say, we can see you in 4 weeks or 6 weeks from now. You can get an appointment. And so, Georgia has really limited access for women. And women need to be very, they need to exercise forethought at this point, knowing that the circumstances are what they are. And we need to make sure that women know that contraceptive services are available and that things like emergency contraception is available to them.
That was a great segue. So what are the circumstances currently in Georgia under which a woman could receive emergency contraception?
Well, Plan B, the levonorgestrel 1-dose regimen, is available over the counter without a prescription. And so women have access to Plan B, which they can use after unprotected intercourse or even intercourse where barrier protection was used, but it failed for whatever reason. Emergency contraception is available at your local pharmacy, and you can pick that up without a prescription. It would need to be used within 72 hours of the event, the Plan B itself. Now, there is another version of emergency contraceptive, ulipristal, which is effective for 5 days after the event, but that does require a prescription at this point.
So you would still need to at least have a provider in order for you to be able to even access that one.
Yes, absolutely.
And there's still a small window. So we're talking about 5
3 to
days?
5 days, yes.
Okay.
Plan B has to be utilized within 3 days, and ulipristal, which requires the prescription, can be used within 5 days. There is also the copper intrauterine device, which can be used for emergency contraceptives within 5 days, but this, of course, requires placement by a provider who's trained to do that. And it also, the barrier is also monetary in that intrauterine device can be very, very costly.
Okay, so if you don't have insurance or you have limited financial resources, then that one may not necessarily be a realistic option for you.
Right. It could cost like from $400 to $1,300 to have a copper IUD placed.
Okay, so definitely not an option for, as we're talking about how many people are uninsured in Georgia,
Right.
like thinking that is not even necessarily an option that would be realistic. And you talk about people being uninsured, and I know that there are some places where you can get free contraceptives, and I know that
Yes.
Birth control pills potentially can be one of those things. But when we talk about lack of insurance and lack of access, like how easy is it then for people to be able to, even when you talk about women need to be informed and really think about their options, how easy is it for someone to access if there's a language barrier, immigrants? I'm thinking about people in rural areas or people with a lack of transportation, insurance, all of these factors that could be barriers in general. How realistic is it for women to be able to access some of these things?
So yeah, those obstacles will have to be overcome. Our local health departments in the various counties in Georgia are places where women who are uninsured can go and receive some basic services in terms of contraception and screening for things like sexually transmitted infections and cervical cancer. And so using the local health departments would be probably the most readily available option for some of these women with very limited resources. Going back to abortion access, there are medical abortion regimens that can be ordered online for, okay? And we don't know how vigilant law enforcement will be with regard to monitoring what women are ordering from parties overseas or out of state in order to obtain access to medical abortions. So misoprostol is an agent that causes uterine contractions and can be safely used early in pregnancy to achieve a medical abortion. And there are resources online where women can obtain those particular medications.
So what is the safety of that? Because I know that is one of the concerns that for women who are, and we know that if women have resources, they could potentially go to another state where abortions are legal.
Right.
However, for women that don't necessarily have resources, like how safe are some of these things that women may be ordering online out of maybe desperation or
well, it's safer than the alternative of undergoing some kind of unsafe procedure locally. Okay.
Yes.
And so very early in pregnancy, those medications have been shown to be very safe.
Okay.
So misoprostol, prior to 10 weeks of pregnancy is an exceedingly safe way to achieve an abortion. Of course, if law enforcement is really cracking down. Now, there are many DAs who have said that they are not going to prosecute people who are seeking abortions or providing abortions. But, you would obviously have some that are of a different state of mind or opinion. And so that would be embarked upon at the risk of, law enforcement penalties.
So that's a good point. I guess so. Two things. One is, are women, is there a site specifically that women can know that they're getting? Because I know that sometimes people will take advantage of when women may be in situations, and they'll create websites and offer products that aren't regulated. So the first question is, how does a woman make sure that she's ordering something online that is safe and effective and what she actually thinks it is?
Yeah.
And then the second question being, about these legal ramifications. We know in Nebraska, this just happened, but I understand that there were some other circumstances that led to the police investigating these social media searches, because there was a burying of an infant that was born. So I know that that may be more of an extreme case, but for you all, in terms of providers, like, are there any legal ramifications for you in terms of if you're giving information, or what you're able to do in terms of being able to support women with options that they have available to them?
So the law does not make it clear, for providers what the penalty to providing certain information to women would be. Okay. It does not seem that a provider would be liable for providing information, okay, but for providing an actual abortion, for performing an actual abortion, or providing medication by prescription with, Dr. Wesley Chambers' name on it, then that could result in penalties of up to 10 years imprisonment. If it's shown that you provided this care to someone who had a baby with a potential heartbeat.
Okay.
Now, they have made exceptions for situations where the life of the mother is at risk, and for what they call medically futile pregnancies. And so theoretically, miscarriages would fall under the medically futile pregnancies. Ectopic pregnancies should fall under the medically futile pregnancies. However, these people that are writing these laws are not physicians, they're not scientists, and the people that may be prosecuting you or judging you or sitting on juries may not be either. And so it can still give providers some pause, that these penalties are out there, and it may slow down providers from providing even, obvious appropriate treatments to women who are not, undergoing an elective abortive procedure.
So that's good information too, for people to understand when they would qualify post heartbeat for a procedure. So you mentioned if you what your language was.
So if someone is having a miscarriage, if we saw a heartbeat last week, and then we find that the patient is having cramping and bleeding and symptoms that suggest a miscarriage is occurring, and then we repeat an ultrasound and now we don't see a heartbeat, well, who's to say whether an overzealous prosecutor might look at this situation and say, well, a heartbeat was detected. How do you know that this was a medically futile pregnancy? How many times did you repeat this follow-up ultrasound? What other data did you have? Somebody might disagree with your clinical decision making in some of these areas that are clear to us as board certified providers, but maybe less clear to lay people.
So if somebody wanted to be litigious, they could get an expert on there who could say, well, I mean, it is possible that, and so then that opens up this realm of possibility. So now that you as providers, instead of being able to do what you feel like may be in your best clinical judgment, now you have to think about what prove?
Right. Yeah. How much proof do I need to defend myself
Hmm.
against the penalty of possibly a 10-year prison sentence?
So then this woman who was having this miscarriage, has to continue
To
through.
yes, she might have to continue to suffer. Whereas prior to this bill being enacted, we would most likely intervene and may be able to do give medications or perform
Mm,
a surgical
mm.
procedure that would end the suffering that's going along with this process. But we may be inhibited from doing that for fear of legal retribution.
So this already traumatizing process becomes even more traumatizing for this person, because now I have to be able to prove that it was medically futile.
Right, and every provider is going to have a different threshold of
Mm,
what they are comfortable with doing, given this total. It's a total change in the environment in which we practice.
mm.
We were not trained to practice in a world like this. You
Yes.
know, we were trained to practice where Roe v. Wade was the law of the land
Hmm.
before I was born. You know, and so let alone when my training began. And so it's a whole new world, and we'll have to, every provider is going to have to decide how they navigate it. And but in the bottom line is that women will suffer, and women of vulnerable communities, women with lack of resources, will suffer the most. In the state of Georgia, uh, 65% of abortions are sought by Black women. And so just that alone shows that, Black women are going to be impacted more than most, uh, compared to, 21% of abortions are sought by white women in the state of Georgia. Now, and the reasons for women seeking abortions are usually economic. Um, so they might feel that they don't have the resources economically to provide for a baby. They might feel that they need to further their education in order to obtain the kind of life that they want for themselves and for their future family. And so these are the chief reasons that women choose to access reproductive services. And so you have 20% of Black women in the state of Georgia living in poverty, and a lack of access to these resources will ensure that more of them remain in poverty.
Absolutely. And that is I think the other part of the conversation is we kind of shift to, you don't want to, or you want to take away our ability to make decisions about whether or not we have children, but you don't necessarily make sure the children are taken care of when they get here.
Yeah, so that's, when we get into the morality of giving the rights of citizenship to fetal or embryonic uh, potential humans, um, that that question becomes very dicey, because uh, we've the law has given fetal personhood some degree of rights of citizenship, and so now women can declare their unborn fetuses on their taxes. And so if a fetus has rights, then what does that mean for other laws in the state? So if what if a woman is not finding out that she's pregnant until 8 weeks, and then she goes to another state to seek reproductive services? Can she be prosecuted for kidnapping? Because now, if the fetus that she's carrying is a person too, can her family say that she kidnapped her baby and took it across state lines? Though a fertilized egg as a potential human getting the same rights of citizenship as adult women is very problematic, because right now you're denying adult women the rights to privacy, to just make medical decisions between themselves, their families, and their doctors, and you're denying them bodily autonomy as you give rights to embryos. That at 6 weeks it's not even a fetus yet, it's an embryo, and this is a potential person. But now the thinking, breathing human in front of you is being denied, their constitutional rights, I think, to privacy, bodily autonomy. And so I think the moral question becomes quite, disturbing when you think about it, because when did we can ask ourselves, when did Black people in the United States get full rights of citizenship? When did we begin to expect equal protection under the law? Was it when we all got video access on our mobile devices? Because, Ahmaud Arbery's killers just got sentenced to life, but would they have been sentenced at all without the video evidence proving what they did and proving Ahmaud Arbery's innocence?
Which was leaked.
Right. Yeah. So these questions, for me as a African American in the United States, it's somewhat disturbing, because it was legal to abort Trayvon Martin when he was a 17-year-old potential, full adult human, right? But now we are giving full rights of citizenship to a fertilized egg.
Right.
And just the science behind what percentage of fertilized eggs make it to live birth. If we're being generous, what percentage of recognized pregnancies actually make it to a live birth? There may be 25 to 40% of recognized pregnancies actually ending in a live birth. And so, we accept that nature is going to lead to that level of mortality for these fertilized pregnancies. So can you imagine accepting in our city that, every week there's some event that leads to 25% of lives being lost in the city, and us just saying, okay, that's okay, that's fine. So if you're equating the life of the adult woman and the life of the importance of the life of the unborn fertilized embryo, then I think you're doing a grave injustice, and I think it's very insulting to people who have experienced life as like a Black American in the United States.
Absolutely, absolutely. And that was so well stated, because again, we often ask ourselves the questions, do we matter? And so, once again, you're telling us, well, you only matter when it comes to whether or not we want to regulate you bringing a child, which you have no control over, whether or not this is going to result in a live birth. But we want to regulate that, but we don't want to protect you once you're born.
Yeah. And we know that women who are in vulnerable situations, who are forced to carry pregnancy to term, will experience a higher chance of dying because they were forced to carry the pregnancy to term. There is a certain maternal mortality rate in the state of Georgia, and we know that for Black women, it's much higher than it is for other populations. And so, you're denying women access to reproductive services, forcing them to carry a pregnancy to term. And there are some people estimating, some studies suggesting that we may increase the Black maternal mortality rate by another 30% by denying our women access to reproductive services.
And that's a huge increase and a good segue into this discussion about the high maternal mortality rates. We were talking a little bit about controlling for some other factors in there, but even in controlling for those other factors, Georgia still is leading at the top of these high maternal mortality rates. What are some of the reasons why? You mentioned a few of them as you were segueing into this. What are some of the reasons why, and particularly women of color, are experiencing such high maternal mortality rates?
Well, women of color do have higher risk factors for some of the just factors that would increase their risk of dying during pregnancy or in the postpartum period. African American race just by itself is a risk factor for cardiovascular disease, and cardiomyopathy has been found to be the leading cause of maternal mortality in the state of Georgia. And then hypertensive disorders, we have a much higher burden of hypertensive disorders in our population. We have a higher burden of pre-existing diabetes. And a lot of our women they have barriers to accessing healthcare to control some of these comorbid conditions. And so, we end up entering pregnancy sicker already than other women. And there are other factors such as quality of care. We find that when African American women have the same kinds of problems during pregnancy that other women have, that African American women are dying of these same problems more often than white women. And so some of that may be that Black women are getting their maternity care in places that have a lower quality of care than white women. That may be part of the issue. But another, like I said before, it's a multifaceted issue with many factors playing a role.
And I know sometimes Black women have expressed that they haven't felt heard when they brought up concerns to providers, and it feels like it's dismissed. And so that might have been an opportunity for an intervention to occur, but a woman was sent home. Because there is, as we talk about some of the racial bias, that one, I think there is a perception that Black women can handle more things. But then two, that I think there's also a bias that we tend to exaggerate our symptomology. And so I do believe, like you mentioned, the quality of care piece, that we also have to talk about that culturally responsive piece of care. Are you actually seeing a provider that is going to hear you when you bring up concerns? Are you working with someone who is going to take you seriously when you say something's not right?
Right. Yeah, I mean, so women need to be more aware of some of the warning signs that something might be going on that may need to be evaluated, as far as cardiovascular disease and things like that. If women are experiencing shortness of breath, so a lot of providers may suggest that, oh, that's just pregnancy. As you get bigger, you get short of breath. Well, no, I mean, to some degree, the physiology of pregnancy can make you feel short of breath at times, but you shouldn't be feeling short of breath with just doing your daily activities. You shouldn't be feeling short of breath, at rest, surely. And so, we've got to pay attention to warning signs like that. Edema to the lower extremities that's very severe, or kind of rising up the lower extremities over time. We need to pay attention to feeling like the heart is racing, or feeling chest pain, and so we should have a low threshold for evaluating our providers and asking ourselves, is my provider hearing me?
Mhm.
Are my concerns being properly addressed? And sometimes if you have a feeling that something isn't right, with your interaction with your provider, I think the first thing you should do is ask more questions
Mm.
to get some kind of clarification. Maybe there was a miscommunication, maybe there was something that was misunderstood in what was said. And if you are happy with the clarification, then it may be okay to stick with that provider. But if your concerns remain despite all your questions being answered, or if your questions are not being answered, then surely there's a problem. But if your concerns remain, then it might be worth considering finding a provider that values you as a person and that shares your values.
And thank you for saying that, because I think sometimes women feel like they need permission. They don't want to
Mhm,
be a burden. They don't want to be bothersome.
mhm,
They don't want to be labeled as difficult.
mhm,
And, some women are fearful, especially if this is a first pregnancy. Maybe they don't have a lot of support. Maybe they don't know a lot about, like you mentioned. And sometimes people will give you advice and say, oh, well, swelling is normal, or you being short of breath is normal. And so we don't begin to ask questions because we don't know the questions to ask. And so sometimes we don't feel like we have other options, like this person is the expert. Surely they must know. And I just need to listen to them, even if there's something inside of me, that nagging piece of me that's like, that didn't quite get answered. I didn't quite feel comfortable with that. I wasn't sure if I was heard. I didn't feel like I could really express myself. I felt like I was being hurried or rushed. So I'm so happy that you said, if you're not feeling like you're getting what you need, it is okay for you to go seek another provider.
Yeah, absolutely. Like I said, cardiovascular disease is one of the main, or it's the primary cause of maternal mortality, and it is affecting Black women more than other women. And so women who are obese or have hypertension, they may not, if you just have one symptom, okay, if you have swelling, but you don't have a history of hypertension and all your vital signs seem normal, then that may not be reason enough for you to be sent to a provider. But people with hypertension or obesity and hypertension, and things like that, a lot of women should be seeing cardiologists during their pregnancy.
Mm,
A lot more women than are should be referred to cardiologists to have baseline evaluation of their heart to make sure
mm.
that there's no underlying disease. And I think getting that done in a lot of the women that have risk factors will greatly improve the maternal mortality rate in the state of Georgia. And so we need to get past whatever barriers there are to women getting that access, and we need to make sure providers are identifying risk factors and sending women who are at risk.
And part of that barrier may be lack of education. So women may not know that they can ask for, like, hey, I have um, this history. We have a history in my family. I've had some, I've got these risk factors. I want to be able to see, would they need to go to a cardiologist, or how would they be able to get?
Yeah, so I have a very low threshold of sending my patients to both maternal fetal medicine providers,
Okay.
perinatologists who are obstetricians with a higher level of training to address underlying medicine issues, but also sending those patients to cardiologists to have at least a baseline evaluation. Some may only need an EKG to evaluate the heart, but if that EKG is abnormal, then they may need an ultrasound of the heart, what we call an echocardiogram, to look at the structures and to make sure that the heart is functioning the way that it is supposed to be. And if it is not, then we need to be very vigilant around the time of birth to make sure that this patient doesn't have some kind of event that threatens their life. And if they do have some kind of complication, we need to be readily there to respond to it. We need to be anticipating that.
So discuss those risk factors one more time for our
Yeah.
listening audience. What are the things that people may need to know are situations where they should maybe request or ask for that referral over to a cardiologist?
Well, some of it's going to be up to the judgment of your provider, but risk factors like being over the age of 40, being African American, having pre-existing pre-pregnancy obesity, where your body mass index is over 35. If you have pregestation, diabetes prior to becoming pregnant, or hypertension prior to becoming pregnant, or combinations of these issues. Or if you're experiencing certain symptoms like I said, the swelling, shortness of breath, heart racing, feeling like your heart's skipping beats, fatigue, persistent fatigue, these things can be very non-specific, and you could kind of brush it off as like, well, I'm just pregnant. But when these things are happening in combinations, they should prompt some evaluation for baseline disease.
And we want to get in that space, I think, of being preventative. So I'd
Absolutely.
rather you go, like you said, have that low threshold. Let's go ahead and it may be that it's fine, but we'll have this baseline. So we'll have a place to start from.
Right.
And I do think
It's
it's
something
important
to
for us.
compare to, if
Absolutely.
things change over the course of pregnancy,
Mhm.
we can say that, okay, well, at the beginning of the pregnancy, the EKG looked like this, and
Mhm.
now we're seeing some changes. This patient might need to be, even though they're young and seem to be healthy,
Mhm.
they might need to be evaluated for acute coronary syndrome. Pregnant women have myocardial infarctions. They have heart attacks sometimes. And so, we have to have a level of suspicion, for that, and not just assume that because this lady's in her young, early 30s, that
Mhm.
she's not at risk for these kinds of cardiac events.
We also know the infant mortality rate is higher
Yeah.
in certain populations. What are some of the factors that affect the infant mortality rates?
So preterm birth is the major one, and women who are in rural areas who have to drive to get to a hospital when they're experiencing symptoms of preterm birth, they are at a much higher risk of actually having that preterm birth, and then therefore having a higher infant mortality rate. Access to neonatal ICU care is another barrier. So some women deliver at hospitals where if a baby actually has a problem that needs neonatal care, that baby will have to be transported to another hospital, so that care is not present at the hospital that the woman's delivering at. I have privileges at a hospital with neonatal care. I'm fortunate enough to work in an environment where that's readily available. But I think women need to know whether or not their hospital has that.
Okay, so that's an important, as you're working with your provider, trying to figure out who's going to be a good fit for you, then also knowing where they have privileges in the event that there is something that happens, we readily have access to
Absolutely.
some of these neonatal units.
Right. Yeah.
Okay.
Yeah. And there's these trends toward home birth and things like that can really increase the risk of a complication, because if you're at home and you have a baby that needs resuscitation, that 15 to 20 minutes that it takes to get to a place where you have NICU staff could be critical.
And so as we go back and we think about some of these other factors, like not having adequate health care, or being someone financially that is not in a stable situation, not having access to a provider, and then we talk about now now, because I do recognize that some women either don't realize they're pregnant or wait until they're about to give birth to even access a provider. So could some of
Yeah.
those factors also affect, because I didn't maybe have good prenatal care?
Yeah, I mean, seeking prenatal care early,
Mhm.
that's very important.
Okay.
Seeking preconception counseling. I
Mm.
mean, it's quite rare that women make an appointment at my office to say, "Hey, Dr. Chambers, I am planning on becoming pregnant again.
Mm.
I had such and such complication with my last pregnancy. What should I do prior to getting pregnant to reduce my risk?" That those visits are very important. Uh, like I said before, a lot of women are not seeing doctors outside of pregnancy. A lot of women wait until they have a pregnancy before they seek medical care at all.
Mm.
And if you're not doing things on a regular basis to maintain your physical health, then once you get to the point of pregnancy, the risk factors are there, and we just have to deal with them. If you come and seek care early, then we are better equipped to identify what your risk factors are and to make the necessary interventions. But late prenatal care, which a lot of times is, a lot of women will come to me and say, "I've been trying to get on Medicaid for the last 3 months,
Mm.
you know, and I couldn't get an appointment with you because I didn't have a Medicaid, I didn't have any insurance."
Mm.
And so that's often the reason why women are not seeking care. But yeah, we've got to consider that we as individuals play a major role in our own health, in our own health care. Uh, these conditions that African Americans suffer from, a lot of them are preventable with, like, or at least modifiable in a positive way with lifestyle change.
Mm.
And so, changing our lifestyles and making it cool to live a healthy lifestyle uh, is something that we as a community and culturally we need to really start thinking about.
And I think about all these other factors you were talking before is multi-layered. So, if I live in an area where there's a food desert, or,
Yeah.
I don't have education and information about how to manage eating healthy foods,
Mhm.
where to get healthy foods from. I remember when I was living in New Orleans around my college, that grocery store closest to my college, the fresh fruits and vegetables were never fresh fruits and vegetables. And so, if you think about whoever was in walking distance and this was their store, that there wasn't even quality produce for them to be able to access. And honestly, processed foods are cheaper as we think about like
Right.
this economy a lot of times, and I'm trying to make things stretch.
Mhm.
I can make that box of potatoes stretch a lot longer. Um, and so I think sometimes it is so many other factors about like how we're even taught about how to eat
Mhm.
growing up. And like you said, with some of the poverty pieces, some of those conversations aren't necessarily conversations being had. And I know a lot of people smoke
Mhm.
as their coping mechanism.
Yeah.
Um, and so adding that, as we talk about recommendations, because I do think it is important for us to have that conversation.
Mhm.
What are some of the things that you would say to women about even before you decide to become pregnant, while you're pregnant, after you have your baby, people are breastfeeding. What are some ways women can take care of themselves? What are some of those recommendations that you have?
Yeah. So nutrition wise, you know, it is hard because there are so many systemic factors as to why people are not getting access to healthy nutrition. Uh, Educating ourselves is factor number one. I mean, even when we were in sharecropping situations, we grew our own food a lot of
Mhm.
times. Beside our little shack on our little piece of property, we would have our own little garden where we would grow uh, organic fruits, and vegetables. And so this is, if you do have some land or something like that, then that's something that we need to incorporate as a community. So some of these systemic things need to be addressed. Some things are personal and family associated that need to be addressed. But the weathering of just experiencing being a Black woman in the United States can have a deleterious effect on one's health over time. And so, we're seeing evidence that these systemic factors that continue to burden vulnerable communities, when it comes to environmental justice, where people live, Black communities are very often in places where there are toxins, produced right alongside the residential area. And so, we have to think about policies that will impact the health of our communities in a positive way going forward. And these policies are not always just monetary. It's not always just jobs. Okay, if you go to a job around the corner from your house, but that place of that factory is producing a toxin that's poisoning your whole neighborhood, then you don't need that job. That community does not need those jobs. It's not worth it. So we have to think about, we got to vote. Voting secures other rights, and voting impacts the policy decisions that get made at the state and local level. And so ignoring politics sounds cool. It maybe it's more entertaining to do other things with your time. But you need to know what is going on, and you need to know who is being put in office, and you need to have, we as a community need to always have our voice heard, so that the policy decisions that are being made respect us as a community and our voting power. If we're staying home, then we can be ignored, and the policies will go to help other communities that are participating in the civic process.
Definitely, I think I would love to see community gardens, for us to be able to take some of this land that we have in each of our cities, that's being underutilized. And yeah, I could have a garden so people can come and get fresh fruits and vegetables, or we can have churches or community agencies deliver these fresh fruits and vegetables to kind of help offset. And that means, yes, we're going to have the right leadership in our government in order for some of those things to happen. And also our organizations that we're all a part of, doing things that we can, educating. I appreciate you taking the time to provide, educate. You shared some information with me that, we always are able to learn, and hopefully with some people that will be able to pass it on, that hear the words that you've shared, to be able to help. If I always say, if you help one person, then to me it was all well worth it. And so you may have saved someone's life by giving them information that could be helpful to them. It's all tough. Like, it's tough to change diets. It's tough to undo systems that you have some control over and some control you don't have over. And you try to figure out how I can balance and do things maybe that I wasn't taught to do. And find resources where they are limited. And it's a lot to put on mothers, which is why we're having this conversation, because now you're forcing people to be mothers who should be able to make the decision about whether or not that's a journey they're ready to take at this point in their lives. Any other parting words you want to share, Dr. Chambers?
Well, I want the women of Georgia to, consider your health at least on a daily basis. You do something for your own health and well-being, and for that of your families on a regular basis. Make it a habit. And I think that's some things you can't control. You can't control whether you have a hospital in your county, but you can control whether you walk your neighborhood, for 30 minutes. You can, and provided me as a provider, I kind of think about the things that I can control. And so having a low threshold for getting women the screening services that may be necessary to identify the risk factors that may be associated with maternal mortality is something that I try to do. And so, I think that we need to just empower ourselves, and with God's help, just educate ourselves. And when you know a little bit better, do a little bit better. Just try to learn a little something every day, and improve yourself and share it with your community.
I thank you for that word, because sometimes we do feel disempowered,
Mhm.
and like we have so much weight that we're carrying. But when we hear from people like, hey, you can't control all of that, but let's focus on the things you can control. You can go out and get a little walk. And now you can walk in your house. So much stuff available on YouTube these
Mm.
days, where you can actually do walking things around your house, that you don't have to go outside if your neighborhood isn't safe. So there are ways to be able to do that. And like you said, I can work with the foods that I do have and maybe just add some things that are a little healthier, replace some things, and try to make those small changes. And that sounds like that can make a big difference. So I thank you for empowering our viewers. I want to thank you. I appreciate your time coming on the show. Dr. Chambers is actually on call tonight, and he took time of his busy schedule to be able to share this information with you all. We have a couple of more episodes of Tea Time with Dr. Tarver this month that are part of our conversation series. Next Tuesday, the 23rd, will be the conversation, The Children COVID Left Behind. And on the 30th will be the conversation, The Forever Heartbreak of Losing a Child. Dr. Chambers, thank you so much for all that you do for our community, for all of the ways that you help encourage and support and nurture women in their health journeys, as well as through their pregnancies. Thank you for all of the work that you're doing, the seen and the unseen, that is behind the scenes. So you take good care, and everybody be well.